also goes to, and I try not to get on these soapboxes, but I do. One of the things that obviously with everything that's going on in society right now, and very much appropriate conversations about race and stopping systemic racism and promoting just this culture of inclusion and humility, the thing that I always have struggled with from our field of psychology, and my mind always beats me up for saying this, and I don't know if I want to put this out on the internet, but I'm going to, it's tough for us to be the field of social justice when we only see 7% of the population, when we're only reaching 7% of our community. And that's one thing that really drives me, and similar, it sounds like for you, is this idea that we get to reach our community. And what better way to promote social justice, and what better way to reach and really promote what we're trying to promote of ideas and our values in psychology than to do what we're doing in primary care.
You hit the nail on the head. Absolutely. You can't really enact social justice if you're not present.
Correct.
You got to be there. You got to be at the spot where you can be helpful. And that was also a key piece of the transformation for me, because I started working at this community health center. Lawndale neighborhood historically actually is key in the history of social justice and civil rights in America. Dr. King actually resided there for a period of time, especially around the time of the riots that occurred during the civil rights movement. There were some huge riots there in Chicago, on the west side of Chicago specifically. And so by being accessible as a member of a primary care team, I realized that I had an opportunity to reach populations that wouldn't naturally come to a mental health office, either for issues of stigma or from because of insurance barriers or logistical barriers. And having that place also, frankly, I found was a more culturally appropriate place of service for those underserved populations. In this case, I'm talking primarily, it was basically half African-American, half Mexican, Latino population. And so I realized that and this hits home for me because I grew up Hispanic in New York City to working class, poor immigrant parents, getting our healthcare in the emergency room at Queens General Hospital. I realized that in order to reach that community, I couldn't adequately do that in my own sort of private practice somewhere. And I think intuitively, that's part of the dissonance that I felt through the training that I had, that there was something about it that didn't match me. And it didn't match what I felt like was a meaningful way to reach underserved populations in particular. And so that really drove it. But the other piece, again, to emphasize, is this idea that a team of healers makes a whole lot more sense than individual healers. That may run somewhat counter to more of a Northern European sort of sensibility that we've sort of imported to some degree in our American culture. I would actually say that most any cultures, generally speaking, respond well to that whole idea of a sort of a community of healers. But it's certainly the case for African-American, Latino populations. It was almost magical for me to realize I'm coming into these rooms, and because these people have had their bodies touched, because someone has talked to them about their physical health before my visit with them, or just as part of the context, I can come in and somehow the potency of what I do with them is increased because of that reality, that I'm not doing this myself. I've got a physician or a PA or NP who's also dealing with the other parts of their life. And then I'm coming in and talking with them about these parts of their life. And then we're blending those two together in ways that bring them together. You know, the diabetic who's having trouble eating and depressed, and right. We're bringing them together in a potent way that just makes more sense for underserved ethnic, minority, and racial groups. that was such a turn on to me. That made me feel like, you know what? Yeah, this is why I want to do, why I want to do this and why I want to do it this way. Because the standard model, the sort of what I call the Sopranos psychotherapy model, like that only works in the movies,
Right. Right.
literally. Either
Yeah.
that or you're a rich guy in Manhattan, you know?
Correct. I had a student tell me the one time when we were doing interviews for our internship that he was in New York City. I forget what borough he was in, but he was in New York City doing practicum rotations. He's like, yeah, he's like, in a 2 to 3 block radius, we have like, I don't know, it was an ungodly number of psychologists, like 25 to 50 psychologists. He's like, none of them took Medicaid. None of them took Medicaid. And it makes me think about this again, when we talk about like who gets psychological services, a lot of times it is people that can afford it, just because of the way the insurance is structured. And then also it's like my mind is being blown right now about what you're saying about even being on a team, how much that is almost reflecting inclusion and a cultural shift, moving away. My mind just goes moving away from our individualistic kind of Western society view of this, that this is more a team, a family that's coming to that. That's beautiful.